across the country, the Obama administration had this law enforcement, 21st century law enforcement, and they went all over the country and they were advocating. And basically the message was, we got to get better at training for law enforcement officers. I understand that. I understand that training is important. But at the same time, if you're not careful, I am concerned that training will minimize CIT as a program, because it's all about training. And it's not about developing and nurturing a community to change its hearts. And I think that really is a very important role of CIT. Training is easy. I can assemble a training program, and officers and sheriffs and chiefs, they're willing to participate. And training will get you farther. But what are you doing with regards to some of those systems and infrastructures? And local community mental health services is critical. It's very, very critical. Also, dispatchers, what are they familiar with? Well, if you're a law enforcement officer and you go to 40 hours of training, where do you go? Remember I said, where are you going to go? What are you walking into? If you go back to your community, if you're from some community, the dispatchers don't have a clue as to who you are as a CIT. There's no procedure to put you on a particular call event. Well, everybody's CIT. We just put them on a call event. But I don't know anything about it. CIT needs to be engaged. The dispatchers need to be engaged with regards to policies. Many of the CIT programs across the country, and I think rightfully so, it gives an illustration here of two officers. Now, these are two different officers and pictures, but imagine each of the two pictures, they're all working together. And so I've got several CIT officers on a particular shift. I got those particular CIT officers because of their skills and their leadership. But when they are dispatched, a call event comes in to communications. We have a person that's not taking their medication and there's some kind of crisis. So that dispatcher, because of her role as a dispatcher, because of the list of officers that are working that night, they're going to find one CIT officer, and that CIT officer is a leader. And so other officers that are associated with that picture here are going to be present. But the officers understood. All these officers, they know each other, they work together, but it's understood that the CIT officer is the leader. You see, a lot of times people say, well, all officers are alike. No, they're not. Listen, there's some great officers that are here. I've already spoken to a lot of them. Are you telling me that everybody on your agencies or other agencies are as good as you are? Don't be that modest. No, you are where you are because of your role as a law enforcement through experience. I would suggest that you have leadership attributes. I bet you that people initiated you being here because you are a special law enforcement officer. I remember when I worked for the detective division, I'd get a call from the chief and it says, hey, we got a case coming down. I want you to make sure that case is handled right. Why would the chief call me that? Because he knows that that's a very sensitive case. And you know where I assigned that case to? Do you think I assigned that to a case to a person that's only had 6 months as a detective in the detective division? Or maybe to an individual that has a lot of caseloads and hasn't been working out? No. That chief called me, and as a supervisor, I'm going to put one of our best investigators on that particular case. Wow. I would suggest to you, all of our law enforcement officers, great, all of them need training. But I'm here to say that a leadership makes a difference with regards to a crisis event. And quite frankly, and you'll see this coming up, quite frankly, the recruits, they don't know what being a law enforcement officer is. They're going through the classroom. They don't know what it really means as a crisis event. They'll learn, but during that learning experience, it's going to take time, and there's going to be some oversight with regards to that. And maybe one day they will have that leadership attributes of what your possession for those law enforcement officers that are here now. Yes, officers are walking away from great training, but as already mentioned, what are they walking into? So it's community mental health services to support CIT, emergency services, convenient access. The word convenient access is very, very important. We want to separate law enforcement officers from people in crisis as quickly as possible. The chances are that this individual will not assume criminal charges is separating the officer as quickly as possible with regards to that. So CIT training, 40 hours. It's didactic. That means that you're having lesson presentations, usually by PowerPoint, videos, and things of that nature. They're learning about the different mental illnesses, which is very, very important. They're also meeting people with mental illness. A lot of times some of the programs are minimizing that. Don't minimize this. Meeting people who live with mental illness. A lot of times at the very beginning, we used to structure things to talk about. We don't do that anymore. And so, well, what do they talk about? I don't care. I just want them talking. So we have a facilitator, and the facilitator could be a family member, or it could be a consumer, or it could be a mental health person. And the law enforcement officers come in small groups, or divided up into small groups, and they're talking with people that have mental illness. You try to get some numbers of consumers where the consumer is just not overwhelmed by 30 people, and it's only one consumer. You try to get other consumers involved. And depending on the resources, you can get resources out there from your local mental health centers, your veterans hospitals, or veteran outreach programs. There's all kinds of consumers. You get them together, you get the people, and let them talk. Encourage them to ask questions. So the facilitator gets the nervous consumers talking to the nervous officers. And once the nervousness ends, the facilitator backs out. So what do they talk about? They talk about girlfriend issues. They talk about, I want to get an apartment. They talk about, I want to get a car. I want to get a job. Something that we all have in common within our lives to share in discussion and learning about people. It's the personal side of CIT. It's not just about people coming out to a classroom and they're very, very articulate. I want to go some places that consumers are struggling. Some of the day treatment programs, maybe your community doesn't have that, but somewhere mental health providers can assemble some consumers so that you can see individuals with different quality of life issues pertaining to their mental illness, and I want the officers to engage. A lot to talk about there, and I need to move on. Can CIT be lost? Again, can you lose that identity, or you never had the identity? Yes. Here's some things that you can lose CIT. You can have some great training program, but if the leaders move away, you can fail to replace some of the CIT leaders. You can minimize the role of a coordinator. There needs to be coordinators at some of these CIT programs across the state. And they say, well, what does a coordinator do? A coordinator looks after those needs within the community that are working or not working and supporting the officers that are CIT. The law enforcement dominance and controlling. Sometimes CIT programs becomes where it's all about law enforcement. Law enforcement is doing everything and mental health is not engaging with regards to that. Training requires the engagement of the community. This is Portland, Oregon. I know about Portland, Oregon because I helped to start that program in 1995, I think. So it was very, very important that they had a very strong program. Kathy Horry, that's quoted in this article, was one of the ones that came to, she was a mental health representative of her and the law enforcement that came to Memphis, and they saw that, and they reported back. The chief sent them down to Memphis in 1994, I believe, and it says, go down there and see if this is the real thing or not. That chief was strong on community policing, so they came back and they said, yeah, it's the real thing. Over the years, little things started to happen. They started to minimize cutting-backs in mental health services. They losing coordinators. New chiefs were coming in that were not supporting CIT, and pretty much Kathy says, everybody's always wanting to make changes when something was working at the very beginning. And then, so here's the Justice Department comes in and says, you're shooting too many people that have mental illness. And with regards to this, and so a lawsuit, a federal lawsuit was filed, and they're under. And so here's some of the things that things that were articulated, and it's still going on. This lawsuit, these lawsuits, they go on for years with regards to this. While we commend the Portland Police Bureau for training all officers, that was one of the things they went to. We're going to train all officers. Matters of this approach assumes incorrectly that all Portland police officers are equally capable. I didn't say this, guys. These are experts that are looking at this. The experts come in. When you get into these federal lawsuits, they bring in experts and they do this. Capable of safety handling crisis situation fails to build greater capacity amongst qualified officers. and down at the bottom, there is a growing evidence that a crisis team response is likely to result in a better outcome and a reinforced public confidence in policing, meaning they should have held on to the CIT identity. They're not criticizing them for doing all the training. They're saying you lost the identity of the specialization of CIT. More with regards to this lawsuit. First, I didn't say this, not every officer is well suited to effectively deal with people with mental illness. All the time I go out with supervisors and I says, you know, you got a lot of great officers on your agency. Oh, yeah, we got a great officer. Are all of them great leaders and they don't really need you as a supervisor? No, we got some issues on this. I am not abusing law enforcement. I've been there in law enforcement. But let me also say this. There are some communities that are so small that they may only have 10, 15, or 20 law enforcement officers. And I would suspect in a ratio of a small community having 10 or 15 or 20 law enforcement officers, I would bet that every one of those officers are strong leaders and the community supports those 10 or 20 officers. By all means, train all of them. By all means, train all of them because they're ready to be trained. Okay, but you start getting increase within officers. You might have some officers that are not at that level. What if I've just left the training academy and I've only got 8 months on in the department? Is that officer ready to be a leader? Of course not. Yeah, I don't need to express that. Anyway, not every officer is well suited effectively to deal with people with mental illness. For example, during our investigation, a patrol officer stated that his job was to put people in jail, not to provide social services. That's a person who's not thinking about being CIT. New recruits in a basic police academy are not generally ready to receive, absorb, and implement critical information about how mental illness calls need to different in response than the more common police calls. I teach recruits. They're not ready, guys. They're not. Recruits are not in the same light of those experienced officers that are here. They just didn't happen. They went through many years of experience as law enforcement officers. They have heart with regards to that. You merge their heart with their experience, and they come out with great leadership. Some of the recruits, yeah, they may have heart, but they don't have experience, and that's hard to be able to perfect. This is some other things I want to move on here. Yeah, minimizing CIT can be hurtful. Cookie cutter training program where the identity is lost. I've already mentioned that. That's very, very important that you don't do that. Some of the training is great. These are some of the topics. We think that bringing CIT officers back to what we call an in-service or refresher course. You can't get 40 hours. You can say, that's a lot of training. Actually, it's not. But 40 hours is to get them started. And once they get started, you